in the intense world of medical emergencies.
One patient, 3 times stab wounds.
There's nothing more extreme than a code red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, highly specialist teams are ready to react to these major traumas.
ETA 4 minutes.
By road
It's a shooting of a male currently being shot ahead.
and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
This is going to be tight and painful, okay, but it's going to save your life.
day and night.
All right, well done.
From car crashes to stabbings.
He's been hit and stabbed in the head.
Here, where time is critical, lives will be saved.
Everyone clear? Yep.
These emergency doctors and specialist paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
I suspect we are going to be cracking open the blood products en route.
Female casualty.
Filmed alongside the critical care teams, we captured every vital second as these specialist crews work to save lives.
1, 2, 3, roll.
Tonight, a stabbing in Birmingham,
There's 2 penetrating stab wounds here,
Okay, yep.
and he's been hit and stabbed in the head as well.
a man suffers a massive internal bleed,
I'm now self-sitting on my way.
I know, Ron. It's a pretty impressive impact.
a cyclist is hit by a car,
I can't move the left one. I can't move the left leg.
and the critical care team battle to save a man's life.
I think we should stay here for the next about 10 minutes and then really do everything we possibly can for this gentleman.
It's early morning at the airbase, and the crew of the Midlands Air Ambulance are in their pre-flight briefing.
General synopsis today is a ridge of high pressure now is over the UK.
Dr. Mark Nash is on shift, together with critical care paramedic Will Meadows.
We've got good visibility in excess of 30 kilometres.
For the next 12 hours, they're on standby to assist with serious medical emergencies across the West Midlands.
Ambulance service, is the patient breathing?
He is breathing, yeah. I'm not
Okay, bear with me. Is he awake?
I don't know. He looks unconscious to me, but he's
What
breathing.
happened?
A car hit him. He's a chap on a bike.
Is he able to speak at all?
No.
No.
He's
Are you
unconscious.
next? He's unconscious.
Yeah.
Every year, more than 4,000 cyclists are seriously injured on Britain's roads. Many suffer life-changing injuries. Will and Dr. Mark are dispatched.
So it's ready, lifting Cosford at 1421, heading towards Shipnell with an ETA at 1424, head over.
003, that's received. Go to car versus push bike, 35 miles per hour.
An ambulance crew is treating the patient, but is asking for further assistance.
Patient has some pelvic pain, neck and back pain, and it could consider got a respiratory rate of between 30 and 36. No obvious chest injury on their examination.
The accident's taken place near a junction on a main road.
They can't see any houses or no wires crossing that field.
The Helimed crew quickly identify a nearby field where they can land.
Landing. All right. Hi, all right, hello. Hello, sir, all right.
Hi.
What's your name? Ian. Ian, my name's Will.
38-year-old IT analyst Ian was crossing a junction when a car turned right suddenly, crashing into him. The ambulance crew found Ian lying in the road, unable to get up.
Main injury for us is the neck.
Dr. Mark receives an update on his condition.
Sharp, very tender pain to lower neck, upper back. That's why I called you in.
Okay.
He has had 1 gram IV paracetamol.
Breathing-wise?
Breathing-wise, respiratory rate has calmed down. When we first got it, it was about 38. Right. As you see now, breathing about 20,
Okay.
28.
Dr. Mark and Will have been called because there's a risk Ian's broken his neck, a serious injury that can lead to paralysis or even death.
Try not to move your head. I think you're doing quite well there, aren't you? How's that collar feeling on you at the moment?
It's a bit uncomfortable.
The ambulance crew have fitted a cervical collar to stop Ian moving his neck and potentially causing more damage to his spine.
So where are you hurting?
Top of my head, sort of top of my back, underneath, you know, like sort of at the bottom of your neck, top of your back.
Yeah.
That was...
And is that quite central, or is it onto one side at all?
Kind of slightly to the left.
Of your spine?
Yeah.
Okay,
yeah.
All right then.
Like that really hurt when they started touching it.
Okay.
While Will assesses the patient,
It's a pretty impressive impact.
Dr. Mark examines the car. The extent of the damage may provide clues as to which part of Ian's body took the full force of the impact.
Did you see the video, Doctor? We took the dash cam out and put it into laptop.
The police have retrieved footage from the driver's dash cam, a valuable tool to help Mark assess the seriousness of Ian's injuries.
You should see the cyclist just coming down there now.
Okay.
By reviewing the footage, it appears Ian's neck and upper back collided with the car, but Dr. Mark and Will also need to look for internal injuries that may not be obvious.
All right, can you take a deep breath in for us? Okay, and back out. Lovely stuff. Any pain when you're breathing?
It's sort of I kind of like the middle of my back.
Ambulance services, patient breathing.
Yeah.
Is the patient awake?
He is, yeah.
And what's the reason for the ambulance, please?
I've just spoken to a gentleman. He said he's been vomiting blood.
Okay.
When he was vomiting the blood, it was like jelly.
How old is the patient?
He's 85.
So help is being arranged for him now.
That's right. Thank you very much.
Either Sergeant Booth, case 2048.
The patient lives at home and wears a personal alarm which he pressed when he felt unwell. An ambulance crew is treating the man whose condition is life-threatening. Critical care paramedics Alistair McNeil and Faye Pollock are dispatched.
6-2.
This is a crew request for backup with an 85-year-old male with an internal hemorrhage, both bleeding orally and rectally, but significantly hypotensive now, 48 over 20-something. Our heart rate of 116, at 599 on air.
He's going to arrest with that blood pressure.
He is. Roger, Ben, that's all received. Many thanks. Our ETA is 5 minutes.
A suspected bleed somewhere in the patient's body has caused his blood pressure to drop dangerously low.
He's bled that much that he's now got a significantly low blood pressure. We almost, I'd say, incompatible to life.
A normal blood pressure is about 120. The patient is just 48.
So the crew have asked for red backup because obviously he's a very sick gentleman. It might be that we need to give him a vasopressor, which is a drug that Alistair and I can give that they can't. Or it might be that the gentleman has arrested by the time we've got in attendance, and so we're actually going to a cardiac arrest. Hello.
85-year-old Ron lives alone. This morning he began feeling unwell after vomiting blood. Since then, he's deteriorated rapidly.
Okay, Dad.
And his children have rushed round to help.
Has he got a good radial, or is he? Absent radial. So he's got remarkable GCS, hasn't he, for someone whose blood pressure is so low, yeah.
With no detectable radial pulse in Ron's wrist, Faye and Alistair can hardly believe he's still conscious. He needs to get to hospital, but moving him in this condition is risky.
It's probably going to be easier to just come straight down the stairs, so I don't want to sit him up with a really low blood pressure.
The stairway's too narrow to carry Ron on a stretcher, but if he's upright, his already dangerously low blood pressure could drop further.
He's not in any pain. He's not actively bleeding externally now. So actually just taking a few minutes to bring that blood pressure up to get us and him safely down the stairs. Are there any pillows next door, please, lovely? Or anything we can bolster his legs up with?
Raising Ron's legs will help improve blood flow to his heart.
Oh, yeah, perfect. Thank you. That's it. Ron, we're going to... Both legs, Ron. Can you lift your other leg up? That's better.
I'm just going to pop this watch off, Ron. We'll leave it on the side here. Just see if we can find a vein where your watch was.
Ron has a small cannula fitted to his arm, so drugs can be given. The team are now looking to fit a larger cannula so fluids can be delivered intravenously.
Are you finding anything on your side, Faye?
They're definitely blues, put it that way.
Oh, it's disappeared now I've cleaned it.
Fluids should help increase his blood pressure, but his weak circulation is making it hard to find a vein.
Sharp scratch here, Ron.
Ron, just another sharp scratch in your other arm. We're getting you from all directions, sir.
Breathe in and out, Dad. I know, it's all right, Dad. In and out.
Sorry. Good man, well done. I know that's incredibly painful. We just need to bring your blood pressure up to enable us to get you into the ambulance, that's all.
But if I give a small dose of metaraminol through this as well.
Yeah, what's his current heart rate?
Current heart rate is 111, so I don't want to make him any tackier.
With adrenaline?
With adrenaline,
But...
so metaraminol is fine on that.
With Ron's elevated heart rate, Alistair can't risk giving adrenaline to boost his circulation. Instead, he uses metaraminol, which helps increase blood flow to the heart. It's a drug only the critical care team carry.
Stay there, Ron. That's it, drop your leg.
Yeah, then, what I'm going to tell you all, folks, I've got a radial pulse at the moment.
The treatment appears to be working.
So, folks, we are a 77 systolic now, with a radial pulse.
Better, bit by bit, bit by bit.
And are we all sorted outside, ready to go? Because I haven't looked at stretchers outside. So, a little bit more met, and then we move.
Ron's vital signs have improved to the point where Faye and Alistair can try to move him downstairs.
All we want you to do is slowly wiggle, whilst you're like that, towards the edge of the bed. Try not to sit up just yet, just wiggle to the side.
Have a look at those drawers.
Just take your time. Have a minute.
Although Ron's blood pressure's better than it was, it's still dangerously low. Moving him could trigger a cardiac arrest, a possibility that needs to be discussed with his children.
Getting him out of here could drop his blood pressure really badly. This could end up with us needing to do resuscitation on him if he reached that point. I'm afraid so, yeah. We will obviously do everything we can, but I'm sort of giving you a heads up, if you like, that this could go wrong. There's probably no other way of me saying it, I'm afraid.
Okay.
Oh, it's a bit nippy.
Do you want the jacket?
It's 7 a.m. and another critical care team is clocking on.
I've checked the battery on this one. I haven't checked on that one, but...
You haven't checked it on this one?
No. Okay. Sorry.
On duty are critical care paramedics Tom Waters and Stephen Mitch Mitchell.
You put the drugs away then?
Drugs, yeah.
Good.
Right.
Ambulance services, the patient breathing.
No, he's not.
And whereabouts is the patient?
He's on the grass at the side of the canal, by the old pump house in Smethwick.
How old approximately do you think he is?
Mid-60s.
And are you right next to him at the moment?
Yeah, I was just touching him. He's
okay,
cold.
Is he lying down?
Yes, he is.
On his back?
Yes.
So I'm going to give you information on how to give basic life support, okay?
Yeah.
We've already got the help arranged, but I need you to help me, okay?
Yeah.
Put one hand flat in the centre of your chest.
Yeah.
Put the other hand on top and lock your fingers together. Keep your arms straight and push down hard and fast. You're going to push about 2 times a second and say push out loud so I know how fast you're going. So you're going to go push, 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 push.
Push, push, push.
Keep going, don't stop.
Push, push, push.
The patient's symptoms are consistent with a cardiac arrest, a Category 1 emergency. Tom and Mitch are immediately dispatched.
first thing in the morning, just got reports of a cardiac arrest at a pumping station, and that's all we know. 60s male, I think it was. And that's it. That's all we know so far.
Tom and Mitch reached the location within 5 minutes of the call.
Oh, there's 2 crews there already. They're doing resus, so should we take the Lucas down?
Yeah, Lucas.
They take with them a device known as the Lucas that can perform chest compressions mechanically. On the towpath, 2 ambulance crews are already attempting to resuscitate the patient.
Oh yeah. You're all right. Hello. What do we know so far?
Alan, who is in his 70s, had been out walking when he collapsed. A passerby found him unconscious and dialed 999. He performed CPR until help arrived.
So an unwitnessed collapse. Okay.
Asystolic on arrival, CPR in progress.
Okay.
2.5 minutes now. Still warm to touch, but don't have any CPR.
Okay, that's fine.
Alan is asystolic, which means there's no electrical activity in his heart and no heartbeat. Shocking him with a defibrillator would have no effect. They need to try and return some electrical activity to Alan's heart.
Can you just start ventilating? Is that okay? Are you happy with that? Yeah. Good ventilation with the eye gel and good compressions.
Ventilation is used to artificially pump air into Alan's lungs, while chest compressions keep blood and oxygen flowing around his body, buying time before his heart can hopefully be restarted.
So, in summary, we've got an asystolic cardiac arrest, who's an unwitnessed cardiac arrest, but has had bystander CPR. We've now got a good airway.
Yeah,
we're doing ventilations. You're doing some drugs.
8:30, mate.
8:30 for the first adrenaline, and then we could do a temperature on him in a bit. Just to... Great, sir. And I think that will give us an indication if he's been down a long time or if he's, if he's been down a relatively short time.
I would agree. It seems like quite a recent collapse. It feels very warm in his core.
Okay. Okay, so that's quite recent then, isn't it? So he is pretty warm, considering how cold it is.
Every minute that someone's in cardiac arrest without treatment, their chances of survival decrease by 10%. But Alan's core body temperature suggests he was found quickly.
I think considering that, we should stay here for the next about 10 minutes and then really do everything we possibly can for this gentleman.
In Shifnal, to the north of Wolverhampton.
What's hurting you the most?
The most is like that, like there.
Dr. Mark Nash and critical care paramedic Will Meadows are treating 38-year-old cyclist Ian, who's been hit by a car.
So he's gone on that right shoulder.
Reviewing the car's dashcam footage, it looks likely Ian has damaged his neck and upper back.
Okay, so just on the hips here.
But so they don't miss anything, Will gives Ian a full top-to-toe assessment.
Is there anything on the outside of your hips that pain-wise that you're feeling?
That seems okay.
I'm just gonna run my hands sort of down your thigh here. Is that all right? Yeah. Any pains there?
Not quite.
No. And then if I do exactly the same on this side, okay?
Yeah, it's not excruciating pain, but it does hurt.
Right, on top, okay.
Will wants to be sure Ian hasn't fractured his pelvis, a common injury in high-impact collisions that can cause severe internal bleeding and is extremely dangerous.
Do we think that you're able to bring these legs together? Is that manageable for you?
I can't move the left one. I can't move the left leg.
And is that because of the pain?
It's almost like there, my leg's like super heavy.
Don't force it, don't force it. I'll just give you a little bit of a hand. So you're helping me there, aren't you?
Yeah, a little bit, yeah.
Lovely.
It's definitely easier with you doing that.
Yeah, cool. Okay, mate. And we'll just bring this right one back in. Okay. It's not pelvic. It doesn't look like pelvic. It doesn't sound like pelvic. I think low suspicion for pelvic injury given how he's presenting and everything he's got. Nothing neurological. So the worst of his injuries, I think, is the sort of back pain. It says it's lateral. It's not really central. And then he's complaining of sort of thigh, more groin thigh.
I guess he's come onto that windscreen with his chest in the body and here quite, hasn't he?
Yeah.
Yeah. We'll help get onto a scoop and then go from there.
Yeah. Will and Mark need to move Ian slowly and carefully onto a stretcher and into the back of the ambulance.
So what we're going to do, sir, is just roll you ever so gently towards me on this side, and then we're going to put a little plastic scoop under you there, okay?
It's going to be 1, 2, 3, roll, all right?
Yeah.
1, 2, 3, roll.
Lovely. Okay, and back. Okay.
The same again.
Yep.
1, 2, 3.
Oh!
Where was that?
That was like...
And back.
And that.
Top of my back.
Okay.
And what we do now is we fasten your head down, all right?
Okay. Two at the top, two at the bottom. On lift. Ready, set, lift. Okay. Okay, feeling a bit warmer now, Ian?
Yeah,
Yeah. Okay, cool. Good job you're wearing a helmet, right?
Oh, yeah.
Ian, I think at the moment, our plan is to send you up to Shrewsbury, okay, because that's the trauma unit for this area.
Okay.
And you get scanned there, and you get your wounds treated, and then they can diagnose you from there. All right. Okay. The main thing is you're awake, you're moving all your arms and legs, okay. And your all numbers are good. There's no huge concerns from us at the moment, but we've always had a very big impact, and we need to get you scanned. All right.
Yeah.
Given the nature of Ian's injuries, Mark and Will decide to leave him with the ambulance crew, allowing them to be ready for the next emergency call.
These collisions can be fatal. Luckily for this man, yes, he's got cuts and bruises and he's got a bit of a sore neck that needs assessing, but fingers crossed, no significant injuries. He's suitable to go to the local hospital rather than coming with us.
Ambulance service, can I help?
Hello, it's police. We've got officers that have come across the male that's been stabbed. It's got 3 stab wounds.
Right, okay. What's the address of the emergency?
It's at Stitchford Retail Park.
Is it male, adult?
Yes.
Okay, and he is conscious and awake?
No, I don't believe he is.
Not?
No.
Do we know if he's breathing at all?
Yeah.
Okay. Did you say 3 stab wounds?
Yeah, that's correct, yeah.
With a man's life potentially hanging in the balance, Dr. Mark Nash and critical care paramedic Aidan Brown are immediately assigned to the job.
So we're going to Stitchford to a stabbing that is reported to be unconscious. I think it's come from the police. It's about a 15-minute run. And it's an odd time, isn't it? 1:30 in the morning. I can understand if people are out clubbing and stuff, but why someone's out at this time? 7062.
7062, go ahead.
Yeah, Roger, have we had any clinical update from the crews? Because it's all been very quiet.
We've had a very brief update. Male, 18-year-old, has been assaulted, got 2 stab wounds to the head, 1 to the chin and 2 to the abdomen. That is all the update we've got at the moment. I'm press over.
Yeah, Roger, thank you. We're about 2 minutes away.
That's probably going to be it, isn't it? Police are there as well.
Yeah.
So.
Do you think this is it?
I think so, yeah. We'll just pop it out the window.
By the time Aidan and Dr. Mark arrive, the man is being treated by an ambulance crew.
Knock, knock. Hello. Hello. Hello, young man.
A stabbing is a life-threatening emergency, requiring the critical skills of Dr. Mark and Aidan.
Right, what happened to you?
18-year-old Josh was lured to a park by someone he knew. When he got there, 2 men attacked and robbed him armed with knives. Josh managed to run away and flagged down a police car.
Did you see what it was? Was it a Stanley knife or was it a bit of each? Yeah. As a sort of slash across, right, okay, face up fits with a slash, doesn't it, with something like a Stanley knife? In which case, hopefully those are less deep. Have you managed to get down to the legs as well, to have a look down there? Nothing on there? Okay. Where's the worst bit from your point of view?
There's 2 penetrating stab wounds here.
Okay, yeah.
And he's been hit and stabbed in the head as well.
How you doing, Ron?
All right.
All right.
In Hales Owen, critical care paramedics Faye Pollock and Alistair McNeil are treating 85-year-old Ron, who suffered a major gastrointestinal bleed.
Had better days?
Just a bit.
Yeah, just a bit. All right.
I never thought of sitting low my way.
I know, Ron, I know.
Ron needs to get to hospital urgently, but his blood pressure is so low that just sitting up could send him into cardiac arrest.
So let's get to the side of the bed.
You ready?
And down a bit, actually. So side and down. One, two, three.
Okay.
The stairway's too narrow for a stretcher, so Faye and Alistair decide to move him using a carry sheet.
I think if we went headfirst downstairs, that would really go vomiting, wouldn't it? So yeah, let's stick with the feet first. Ready, steady, slide.
Okay, on the edge.
It's an awkward manoeuvre, and due to his internal bleeding, Ron could go into cardiac arrest at any moment.
Oh no, Ron. Keep on going.
But it's necessary.
Ready, set and slide.
If Ron's to get the specialist treatment he desperately needs.
Okay, and lift. Up, 1, 2, 3.
That's
All right,
fine.
Ron. We're outside now.
With Ron safely on a stretcher, the team have pulled off the most dangerous part of the operation. Now, they just need to get him to hospital, and fast.
I'm just going to expose you a second, just so I can get you to Tommy again.
Yeah.
No, well, we do worry about you, Ron.
Yeah.
Before they set off, Faye allows a moment for Ron to say goodbye to his children.
There's some money in your trousers, don't wash it. Take that out, all right.
Due to COVID restrictions, Ron's family won't be able to travel with him to hospital.
Ron, listen to Caroline a second.
Listen to me. You need to get yourself better. Forget what's in the house. I'll sort the house. Just get well.
We all will, Dad. We'll all sort it.
So we're going now.
Can't I go with him?
No, not at the moment.
Shall we get you better? Go on then.
Right, ready?
Okay.
So reassessing, there's nothing external, nothing we can do about internal. From a breathing point of view, we're absolutely happy. We've got equal rising for all of his chest, there's no trauma. Bailey, can you take a radial pulse, please? I've got a really bounding carotid. You've got a good radial, super. 6'2".
6'2", go ahead.
Faye updates ambulance control.
We have left the scene, heading to Russell's Hall. 85-year-old male. Initial presenting blood pressure was 40/20. He is now 105/40 with a GCS of 15. He's had a litre of fluid and he's had 1 milligram altogether of metronidazole. ETA 4 minutes.
Ron's blood pressure has improved significantly, but he still needs critical care in hospital.
So, Ron, we're just approaching Russell's Hall now, okay?
As there's 3 of us, we'll keep him on the monitor,
Yeah.
just in case.
Ron will be handed over to the emergency department, where doctors will try to find the cause of his bleed. In Smethwick, critical care paramedics Steve and Mitch Mitchell and Tom Waters are treating a man who was found unconscious and not breathing on a canal towpath.
Still asystole.
Alan, who is in his 70s, is in cardiac arrest.
On the next 30, we'll just quickly roll him over. You control his head.
As he was found soon after collapsing, Mitch and Tom are hopeful they'll be able to resuscitate him.
What we're going to do, while everyone works around, is we're going to put the Lucas on him, just then we can just do some good effective CPR.
OK, roll him over. That's it, back down. OK, back the other side slightly. That's it. A little bit higher.
The Lucas device performs highly effective chest compressions mechanically.
Hold on. Yeah, OK, it's asystole.
But although CPR is helping to pump blood and oxygen around Alan's body...
His end tidal's good, isn't it? 5.2.
Yeah. OK, that's a rhythm check now. OK.
After more than 10 minutes, he's still asystolic, also known as a flatline. Using a defibrillator when there's no electrical activity in the heart would have no effect.
My thoughts are, we do know he's an unwitnessed cardiac arrest and he's asystolic. This is not a traumatic arrest. We're happy this is a medical arrest and there's no other reversible causes. Those factors normally associated with pretty poor outcomes. I think what we'll do, we'll carry on for another 5 or 6 minutes. We'll give one more adrenaline. If there's any change after that, then that's great.
The ambulance crew give Alan another injection of adrenaline, while Mitch and Tom closely monitor his vital signs.
That's adrenaline in, Tom.
OK, thank you.
That, to me, looks like
Bit fine VF, isn't it? Okay, so carry on with some CPR.
At last, there are signs of improvement. Alan's heart is in ventricular fibrillation, or VF. His heart is beating in an abnormal rhythm, but it is beating.
Okay, 2 ventilations for me. Don't keep your finger off that for me.
Finally, with electrical activity detected in Alan's heart, Mitch and Tom can use a defibrillator to apply electric shocks.
Okay, pop that down and now shock. Everyone stand clear.
Shocking.
Okay, rhythm check there. That's still VF, so same again, so charge. Everyone stand clear, keep your finger away, Brian, keep your finger away, okay?
Shocking.
So far, Alan's heart is not responding.
So that is shock number 4, isn't it?
Yeah.
So it looks a pretty poor VF, doesn't it?
Trace, isn't it?
It's kind of deteriorated a little bit. 17 minutes in. I think we'll evaluate at 20 and we'll go from there if that's all right. But we'll carry on. We'll carry on with it, I think. Yeah, everyone's clear. Okay, shocking.
Okay.
After nearly 20 minutes of CPR, adrenaline and electric shocks, Tom and Mitch have a decision to make. And it's one of the most difficult a medical professional is ever called upon to undertake.
Okay, so we've got what looks like a very poor ECG. And could someone just quickly feel for a pulse while we're there? No pulses. All right. We've got an unwitnessed cardiac arrest who's asystole. I think, considering that, we should stop now. Is everyone happy with that? Yeah? Yeah? Is everyone? Okay, perfect. Okay, well done, everyone. You can stop. Perfect. Cheers. Happy with that, Mitch?
Despite everyone's best efforts, Alan cannot be saved.
Everything that we did was as prompt as we could. He had a full regime of drugs and defibrillation. Unfortunately, the gentleman's passed away and there's nothing further that could be done for him.
Right, I'll shove the hoods here. I'm just going to go through the ventilator.
Back at base, critical care paramedics Faye Pollock and Carrie Penn-Ashman are checking over their kit to make sure they have everything they need.
OK, that's fine. It's not damaged.
On board their vehicle is an extensive range of enhanced life-saving equipment
I've got the ket and the morphine in my leg pocket.
and powerful pain-relieving drugs.
Ketamine is stronger than morphine. There's a couple of things that you can use it for. So if somebody's ankle's completely out of line, they've fractured it and they've dislocated it, sometimes that we'll give ketamine as a bit of a pain relief procedural sedation to pull it straight.
It's also an induction drug, so if we were to go to a case where we deemed a patient to have to go off to sleep, then we could prepare the drug ready for one of our pre-hospital doctors to come and put the patient off to sleep. We're prepared for anything and everything.
Ambulance service, is patient breathing?
I think he's just between a bike and a car.
Is he a motorbike or a push bike?
A motorbike.
Is he awake and conscious?
He looks as if he's moving, yeah.
Right, so is it a car versus a motorbike, sir?
Yeah, it was. It was literally bad.
Okay.
He went straight into the right side of the car and then he flipped once or twice in the air and then landed.
Thank you very much. We'll get to them as quick as we can.
6-2, good morning, go ahead.
This was a motorcyclist. He was going down the outside of the queuing traffic and a car has pulled into his path. Just so you know, we have got a crew en route who will be there before yourself.
6-2, roger, that's all received. Many thanks.
Ambulance control assigned Faye and Kerry to the incident in case emergency life-saving treatment is needed.
You could be the best motorcycle rider in the world, but you've got to guarantee that all the drivers that you are going to come across in that journey are also the best drivers.
Here we are.
Faye and Kerry arrive at the scene of the rush hour collision.
Hello, hi, how you doing? Good morning, sir.
58-year-old Steve was overtaking slow-moving traffic when his motorbike and a car collided. He crashed into the side of the vehicle and was thrown from his bike.
Not knocked out.
No.
DCS 15 throughout.
No back pain.
That's
Sat
fine.
on the side of the road with his helmet off when we got there.
Sitting on the side of the road with his helmet off.
Yeah, he got himself there.
Yeah. All right then.
Having found Steve conscious and moving, the ambulance crew helped him onto a stretcher.
Put your hand in there, that's it.
Once in the ambulance, Faye and Kerry can carry out a proper assessment.
Steve, just look at me a second. That's it, I'm just going to have a little feel of the back of your head. Tell me if I'm getting any pain in your neck first. No. No pain in your head?
No.
No pain in your pelvis at all?
Faye's satisfied Steve doesn't have a major head, spine or pelvic injury.
This is the poorly arm. Let's pop that across there, good man.
But his wrist looks like it's broken, and he's also complaining of pain in his leg.
We need to have a look at your leg. So your trousers either need to come down or cut off. How precious are your trousers?
Yeah, precious.
Oh, they're very precious.
Just let me stand up.
No, I don't need to stand up, because you're not going to be able to push yourself in by you.
Although Steve's keen to downplay his injuries, they may be more serious than he thinks.
What's hurting when we do that? Is it all in your wrist?
Yeah, no, we know it.
Your knee? Okay.
I think this male is 18. So mechanism is stabbing that's given.
In Birmingham, Dr. Mark Nash and critical care paramedic Aidan Brown are treating 18-year-old Josh, who was beaten up and stabbed in an ambush.
And did you get knocked out at this period of time? Yeah, okay. Done a grand job in the face.
Josh has several slashes on his face, which have been dressed by the ambulance crew.
Having quite a bit of pain.
He's also got 2 stab wounds that have pierced his abdomen.
So nothing's actually massively bleeding. We're not going to really know anything more about this until someone has looked properly. What they will need to do in hospital is just have a bit of ambulance and have a look a bit further deeper. There's no point us trying to do that here.
Only a scan in hospital will be able to determine the extent of Josh's internal injuries and if they require surgery.
Can I just have a little fully pulse for 2 seconds? Okay. A little bit fast, but not unreasonable considering what you've gone through. And your numbers...
His numbers are stable. I haven't done BM or temp.
104 is not the end of the world, is it? Do you take any medicines at home or anything normally? Normally fit and well? Have you taken anything else tonight? No.
He said he's had a little bit of alcohol earlier, so
It is what it is. Now it's 18.
The good news is that Dr. Mark is satisfied Josh's condition is stable.
Where's the most painful? Is it head in general? Feels one big headache, doesn't it? Okay.
Now he wants to make sure Josh is as comfortable as possible before leaving him with the ambulance crew.
It's got some IV paracetamol.
Let's go. Yeah. If you felt there's some morphine, then that's fine. But how far is it from here to QE?
Yeah, QE, mate. About 20 minutes. So we're just going to do that en route.
Yeah, just say, yeah. Anything else we can offer you? It sounds like you've got it under control. So. Good. All right. Cool. Well, if you're happy, we'll leave you in peace. Aidan's giving me a bit of a standby for you, and you're there. All right. Best of luck, mate. All right.
Aidan has provided ambulance control with an update.
Well, I've let the QE know, so they're all aware. I've given them a rough detail of 18 minutes.
The ambulance crew will take him to Birmingham's Queen Elizabeth Hospital, where his wounds can be properly examined and treated.
He had some injuries to his face. He had a couple of wounds to his abdomen. None of them looked life-threatening. Heart rate's a little bit high, but then having just been through that, it seems not unreasonable. But they've taken him to the Queen Elizabeth Hospital just to get him checked out because of the wounds in his tummy. The crew had good control of everything, so other than offering our support and making sure everything seemed okay, we've left him to it.
In Birmingham,
So it's a 58-year-old male who was riding a motorbike.
critical care paramedics Faye Pollock and Kerry Penashman have been called to a road traffic collision. Motorcyclist Steve collided with a car and was catapulted into the air.
You stay there. We'll wiggle him down.
He's got a suspected broken wrist.
Is that your leg wincing, not your neck? Okay.
And his leg is hurting.
I take it that's a previous lump.
Yeah, it took a big lump out.
What did they take a lump out your hip for?
You know, it's all smashed.
Oh!
They wake you up with knee.
From your hip?
I am on my hip.
From a motorcycle accident? Kind of used to this then, aren't you, in a way?
Yeah, oh, I have had a few over the years.
Yeah. Steve, can you just lift your leg up? Is that painful to lift that knee?
Yeah, but it's not a good knee anyway.
It's not a good knee anyway. Okay, relax, relax.
Is it more painful than normal?
Yeah.
And this knee. That's it. Okay, bring it down. Excuse me for just a moment. Pain in your upper thigh, pain in your lower thigh. No, can you bring your legs together? Oh, that's it, that's brilliant.
Steve's leg needs to be x-rayed in hospital to find out if he's broken any bones. But for now, he doesn't need immediate treatment.
Relax, relax, relax. That's it.
Next, Faye turns her attention to his arm.
No pain in your elbow there? No. Wiggle your fingers. Oh, what hurts when you do that? That does.
Do you want a splint or anything? Or
Yeah, please.
Steve's wrist is indeed broken.
So we'll pop your arm in a splint, my sweetheart, so it might be a little bit comfy for you.
Relax, Steve.
Faye and Kerry use a vacuum splint to immobilise his arm and prevent further damage.
So basically the air just gets sucked out of this splint.
Who was the lady out there with you? Was that passed by? Was that your partner or?
That's me.
Oh, okay.
She was going to work anyway.
Ah.
She was behind me.
Oh, so she saw it. There she is. Hello.
There she is. What was your name? Ronnie. Come on in, Ronnie, if you can squeeze in. Ronnie, I think at the moment all we can ascertain is wrist.
Yeah. I think he's come off quite lucky.
Well, considering he went over the top of the
Yeah.
Steve, from an analgesic point of view, do you want anything? You can have oral paracetamol, you can have ibuprofen. Are you sure? Okay.
He won't notice his pain because he never does, even when he had his broken leg. Last time he was just, his pain threshold is incredible.
That's right, okay.
A high pain threshold isn't always a good thing. Pain can be a useful tool for identifying where someone is injured, especially if that injury isn't obvious.
Steve, you know that if you start to feel a bit woozy or if you start to feel a bit sicky or pain in your neck, you just say, and
Well, you've been rather lucky, haven't you? It could be a lot worse. I hope you feel better soon. Take it easy. 6-2.
6-2, bad.
Kerry updates the control desk.
6-2, thank you. Injuries, he has a fractured left wrist that's obviously deformed, that's been splinted. He's also got pain in the left knee, but there's nothing obvious in terms of any fractures. He has declined pain relief, and the crew will be travelling to Sandwell with an ETA of approximately 15 minutes. Received, over.
For all of these accidents, and yet he still keeps on getting on the bike.
It looks like Steve can add a broken wrist to his catalogue of motorbike injuries. But it's also possible he has internal injuries, so he needs to go to hospital.
It's very easy to not have anything on the outside but have actually massive internal injuries. And he's gone off to Sandwell, which is the trauma unit, so he's going to the right place.